How do you do an elimination diet? Let's go into a little bit more detail. During the elimination phase, the first thing you need to do is to decide what foods. I would say, if you want to make it simple, you start with the foods here: gluten, dairy, corn, soy, eggs, sugar, alcohol. We can talk in a bit here about how to actually get even more granular, but you're going to choose the foods you're going to cut out. You're going to do it for 6 weeks. And here's the really important part: you're not just eliminating foods out of your diet, you actually have to replace those foods with healthy alternatives. Lots of plant-based foods like whole grains, fruits, vegetables, nuts, seeds that are going to produce or provide the building blocks for rebuilding your gut lining to heal that leaky gut. So the elimination phase should be at least 3 weeks, but ideally 6 weeks, to get you to a place where the antibody levels have dropped because you've stopped eating that food, and then things have cooled off. You're starting to feel good. And then once you've done that, then you're ready to reintroduce at 6 weeks. I will tell you, the first 3 weeks of an elimination diet can be very challenging. You're getting used to new foods that you weren't eating before. You are missing the foods that you love eating, like your gluten and your dairy and all of the foods that are commonly in your diet that maybe you have cut out. And so people feel really good in weeks 4, 5, and 6. And this is why I encourage people to really stay the course and get to 6 weeks. And so if you've gone to 6 weeks, then you go for a reintroduction. Now, the standard reintroduction I do with people is pick the food you miss the most, or the one that would make your life easiest if you were to reintroduce it back in, and then you eat it 2 to 3 times a day for 3 days in a row. Because what you're trying to do is you have let the immune system cool off, and now you're putting that food back in that you suspect your immune system has learned to make antibodies to. And if it's going to attack it, you want to make sure that you're putting enough food in that you get enough attack and enough symptoms and enough inflammation that you can detect a symptom. So that's why we reintroduce heavily over 72 days. There are people who are very sensitive, so I have them do a slower elimination over 7 days. And so if you reintroduce and you find that a symptom comes up, then that may very well be an indication that you have a reaction to that food, that you have a food sensitivity. And as I said, the symptoms could be anything. So which foods should you cut out during an elimination diet? So I would say the highest suspect foods are gluten and dairy. Those would be my top 2 things. If you're going to do nothing else, at least cut out gluten and dairy. You will likely find that you feel better when you're off of them. Now, not everybody has gluten and dairy sensitivities, but many people do. Also, corn, soy, and eggs. And what these foods have in common is that they're found very commonly in our diet. So it's just your immune system has more access to reacting to them, to seeing it, identifying it as a foreign invader, and building antibodies to it. Now, in addition, when we do our gut restoration protocol at Truemedicine, we actually expand this further. In addition to the foods on the first line, we also have people cut out sugar because it's just inflammatory. Beef, a lot of people do react to beef. It's also hard to digest. Shellfish is a problem for many people, as well as coffee and alcohol, which a lot of us get a little bit too comfortable with, and we use them regularly, whether we are medicating ourselves because of headaches or low energy or anxiety. And so we try to come off of these foods as well. Also, we want to make sure that you're on a healthy diet. So we have people, in addition to eating a plant-based diet, removing artificial flavors and colors, processed foods. We just want you to eat real food because that's the most efficient way at rebuilding the gut. And there may be other suspicious foods because a lot of people do react to nightshades. These are tomatoes, potatoes, peppers, eggplants, as well as beans, nuts, seeds, you name it. There's really no limit to what someone can react to. Like, there isn't any food that's off the table. So I let people sort of personalize this for themselves. I think if in a round of elimination, if you can do the first 3 bullets, then down the line, you can remove nightshades, beans, nuts in a separate round of elimination. So that's how it's done. So this is a process that could take a long time, but you could make it simpler by doing it in different phases. All right. So what are the benefits of an elimination diet? Well, aside from identifying your food sensitivities, which is important because if you keep eating these foods, you're going to keep causing gut inflammation. You're going to keep revving up the immune system. And now you have an immune system that's amped up and not terribly helpful to those of us with MS and autoimmunity. It helps lower inflammation, and it's an opportunity to try new foods and new ways of eating and cooking and preparing foods. So it really does expand how you interact with food, and it really does change your relationship to food. I've done elimination diets with my kids. Remember during the reintroduction, we were at the very end, we had reintroduced everything. They weren't really reacting to anything. And my 4-year-old at the time, it was his birthday, and he said, "Can we go to the Cheesecake Factory?" I said, "Sure." We went. And I do remember on the car ride home, all 3 of them, they were 2, 4, and 6 at the time, were complaining about how bad they felt because they had been eating clean for so long. And then they had burgers and cake and, everything you could imagine that would not be on an elimination diet. So even kids can tell after an elimination diet when they feel bad, when they start eating foods that are not so healthful. Okay, so safety first. For anyone who has blood sugar issues, whether it's diabetes or borderline diabetes, low blood sugars, unstable blood sugars, I want you to be very careful with doing an elimination diet, because if we all of a sudden cut out the carbs and the gluten and the sugar in your diet, and you are on medications and supplements that help lower blood sugar, you can go too low and you can have a very bad outcome like death. So if you are on any medications or supplements to lower blood sugar, please be very careful. Talk to your doctor about what you can do to safely go through an elimination diet. Basically, what you'd want to do is do it very gradually. If you are on a very narrow diet already and you have lots of food reactions, I would be very careful about cutting out more foods out of your diet. I do have patients that eat 5 or 10 different foods, and that's all they can do. And it just doesn't sound reasonable to me to say, why don't we cut out a few more of those few foods that you're eating? A narrow diet is not good because now you're missing building blocks for all the things that your body needs. If you have a history of an eating disorder, anorexia, bulimia, anything else, please be very careful. What we don't want is to kind of wake up that eating disorder that maybe you have worked really hard to manage. And so if anything here fits, please talk to your doctors before pursuing an elimination diet, because there are other parts of the protocol that you can focus on and not necessarily the elimination phase.